Welcome to the Dental Brief, the world's direct, right-to-the-point podcast produced to get you the information you need to learn and grow your practice. To learn more about our guests and find links to information discussed on our show, visit our website, dentalbrief.com. On to today's episode.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm so excited to have with us our guest today, coming from sunny Boise, Idaho. Say hello to registered dental hygienist, Alicia Flynn. Say hello.
Hi, everyone. Thank you for having me, Patrick. I'm so excited to be here today.
We're thankful for you taking time out of your busy schedule to join us today. We had a little conversation before we started. I mentioned Boise and we talked about how people are moving there, but from what I understand, it's a beautiful place. How do you like living there?
We love Boise, but tell everyone else that unless they can be nice and not polite, they can't move here. It's a terrible place to live.
Right. It's sub-zero temperatures year round.
Right. Tundra. Yeah.
Rain. Yeah. So tell me, let's just jump right in and tell our audience, how did you become a hygienist? How did you get involved in dentistry?
Sure. Well, a lot of people, my dad was a dentist and I have two siblings that are dentists and I have two sisters that are hygienists. And a lot of people say it's in the blood. And I smile and say, no, it's in the teeth. So is what they need to understand is that I started from the ground up. I started at the age of 10. My dad would have us come down. We'd vacuum. We'd take out the garbages. Then he started training us to do sterilization. And we would turn over rooms. And then from there, he would teach us to help him with emergencies. I grew up in a small town on the base of Mount Hood. And sometimes there were some barroom fights or some arguments that went on. And he trained us in emergencies. And so he would bring us down to the office and help him with an emergency. So I started doing that. And then from there, I married my husband. He was in the Air Force. So we traveled all around the States. And I worked as a scheduler, an office manager, insurance. I also did dental assisting with expanded functions. And then eventually I went back and got my dental hygiene. But as I did this, I realized there were a lot of dentists. They were happy with their practice, but there were problems they were struggling. And I would work with them on how they could have their staff work better together and how they could achieve their dreams. And I realized this was my niche. This is where I was happiest, and this is what made me happy. And so I still do hygiene 1 or 2 days a week, depending on the week. But I love helping dentists gain the practice that they dreamed about before they started dental school or while they were in dental school. I want their practice to be what they dreamed.
Yeah, and that's awesome. That's a great story. Thank you for your service, your husband's service, your family's service, right? We know how that can really wear on a family. I'm sure there's probably times that some dentists were upset when the Air Force moved you to another area too. And I'll just use this as a time to tell people that, hey, sometimes employees move. Don't always take it personally when you lose a valued employee, right?
Yeah, thank you. Thank you very much. It was an honor to serve, and we're really grateful to be out now. So
yeah. So I know you're involved heavily in coaching now, and you started Increda Dental. The website for our audience to check out is increda-dental.com. Tell us a little bit about that, and tell us, just tell us how that's started and how that's going for you.
Yeah, well, it started when I realized I was coaching dentists anyways, and sometimes I would recommend things, and I realized they weren't asking for my help, and sometimes they didn't want my help, but being the person who I am, I had a hard time being silent and staying within the practice when I knew they were missing financially things or they were having problems with their team and they didn't want to move forward. And it's okay if you don't want to move forward, but I wasn't okay being stagnant and I didn't find comfort there. I wanted to help people. And I realized once people when I worked for dentists and I would suggest like, what if we started doing this? And I saw the relief that came on their face and even like their personality kind of changed, their persona become more relaxed because they were bringing in a little bit more revenues. And sometimes it was a lot more revenue, but I saw them pivot. I saw them change and become a happier dentist, a happier provider. And that's where I got my joy. That was like my adrenaline junkie rush. And that's where I realized I want to do this full time. I want to help dentists full time with their practice and have joy in what they're doing. Because when you graduate, there unfortunately is a lot of debt. And then if you purchase a practice or buy into a practice, there again is a lot of debt. And sometimes you feel like you're swimming against the tide, against the stream. And I'm here to help you know that you're not alone in the struggle and to know that there's help there for you. So that's how I got into coaching.
That's awesome. So in your travels now, and I mean that that figuratively, right? Not literally, since you're not traveling the way that you used to anymore, or from town to town. What are some issues and problems that you see that dentists are facing? You mentioned more revenue. Is that kind of based on case acceptance? Are you seeing a lot of issues there?
Case acceptance is huge, and I really wanted to talk about that today. But a lot of times it's holding your team accountable and having you have a goal and you give them instructions, but not holding them accountable for where you want to go. And so one thing that I want to bring up is that only 30 to 50% of cases, when you present a case, 30 to 50% are not accepted. And that is a huge amount that goes out the door. If you ran the numbers on that, you could have $1 million practice. But unfortunately, because they're not accepting the treatment, they're walking out the door. So I wanted to speak today about how we can gain case acceptance and how we can change that. And that is from the Dental IQ. They're the ones who gave the figures. 30 to 50% of dentists treatment walking out the door.
Yeah, I've seen that, and I've also read and heard that the average practice will have anywhere between $500 and $1.2 million in unaccepted cases on their books. So that's a huge amount of revenue. It's not only a huge amount of revenue; it's a lot of people walking around with potential time bombs in their mouth. So, give me some tips? What are some things some dentists can do to help improve their case acceptance?
Well, first off, it starts with a greeting. And I don't want to start with a phone call, but I want to start with in the office. And so the first thing is to greet your patient. You can do a fist bump or a handshake or an elbow bump because of COVID. But it's what we're doing when we provide that contact. We're removing the white coat. We're removing that white coat syndrome. We're showing them we're human and we're going to treat them as an individual. And that is super important that we do that for our patients because we're then becoming approachable. And then from there, we need to call our patients by name. When we meet them, we need to be eye to eye. Meeting a patient when they're laying down on their back, mouth open, oh, hi, by the way, I'm Dr. So-and-so, is very intimidating. And it doesn't give the patient reassurance. When you meet them, look at them eye to eye, be at the same level as them, call them by their name, and lean forward slightly. Let them know that you're engaged with them and you're there to help them. So the first barrier is to remove that white coat and become a person that will help them.
That makes a lot of sense. When you're in a dental chair, you feel very vulnerable. You are very vulnerable. I mean, literally, right? And you feel very vulnerable. And so I think it does make you put up defense mechanisms, right? Anytime you're vulnerable around people, you're going to kind of put up a barrier or a wall. So I think that's a great piece of advice as far as meeting people when they're high.
Yeah. And when we first meet people, there's 3 things we do: friend, foe, or potential mate. So we want to break down and make sure they see us as a friend. So we want to have that. And people are on the defensive when they're in that position of being laid back on their back. That's a very defensive position. So meeting them eye to eye makes a huge difference.
Yeah, that's great advice. What's something else we can do?
So we need to listen to understand. A lot of times we have been trained to diagnose and tell the patient what's wrong. But what we're not doing is we're not asking open-ended questions and listening to what our patient wants. So you're probably like, okay, so what's an open-ended question? So we need to ask them, like, what is your top concern? What brings you into our office today? If there's anything I could help you with the most, what would it be? So we need to listen to what they want, because there's a lot of things that patients want. But if we don't address what they feel is their want or their need, they're not going to schedule. They're not going to come back and see us. So we need to ask them if there's any barriers that keep them from coming into finishing or getting treatment done too. That's a really powerful question.
Sure. So I think that's, by the way, it's, again, fantastic advice. Why don't you give us one more thing that we can do to increase patient case acceptance?
So we'll address their barrier. So if it's fear, this can a lot of times be done by the assistant or the front office. If it's fear, you can just tell them, oh, you are at the best office. Dr. George is the best at this treatment, and he will make sure you're comfortable. So address their fear and remove that barrier. If it is maybe financial. We're going to talk about that we have financing options, or let's say it's insurance driven. We want to talk about, we have our upfront person, Susan, who does an incredible job with insurance, and she will make sure that the insurance pays as much as they can so you don't have a bill. However, the insurance does not see what we see, and they cannot understand what's going on in your mouth. But we will do everything we can to reduce the fee to you.
Sure.
So we need to address that. Yeah.
Yeah, that makes a ton of sense. Yeah, and I think the same thing, having the team, which I think we're going to have you back on to talk about where I'm going with this next statement, but I think we need to have it so the team does do that. But, as far as saying this is the best dentist, but I think the team has to believe that, right? So it has to be sincere. And I think oftentimes that's not the case, right? And we'll get into this, but I think we'll have you come back on and talk about that later on. But oftentimes the team doesn't think it's the best dentist. They don't even like the dentist. They're looking for another job because whatever. So let's get into that, on another episode for sure. So give me one more little tip or trick.
So the other thing is time. We have to respect our patients' time. We are so different today than we were 15 years ago. Now people realize that time is a commodity and it's not something that's refundable. One of my favorite jokes is, hurry up, you're wasting time. And the person replies, how can you waste something you don't have? So we need to respect our patients' time. And so patients may say, it's really hard for me to get into the office to get treatment. And then let them know, well, we could do your treatment spaced out 4 or 5 visits, or we can see you and 1 or 2 visits. They'll be a little bit longer, but it'll be over and done with. But then you need to come back for your maintenance appointments so nothing else gets away from us. So
yeah, a ton of sense. Yeah, and I agree. I tell people all the time, like, if you have a cancellation, whatever your last minute cancellation policy is, what your last minute cancellation policy should be. So it should be, let's treat our time equally, because that it is equal. Everyone has the same amount of time in a day, right? So I always say that, like, hey, if you're going to charge $100 no-show fee, you better pay $100 no-show fee whenever you make an appointment that you don't show up for, right?
Mm-hmm.
And then you're actually treating the patient fairly, right? It's
right.
What you are doing yourself. So let me ask you this last question. If somebody wants to vet an expert such as yourself to help them in their practice, whether it's case acceptance or building teams or making your team feel that you're the best dentist on the planet, how do you go about trusting, or how do you go about vetting that person and making sure you find a good fit for yourself?
So I want to make sure I understand. So how do you go about getting the right staff? Or
No. So how would you vet someone like an expert such as yourself, a coach?
Sorry. Thank you so much.
No problem.
Yeah. So first off, I do 1 hour free consultations, complimentary. You can visit with me, no charge, no pressure. I want you to succeed. So you can go to my website, increda-dental.com, and it's the dash symbol, not the word. And you can sign up, go there and schedule a free consultation. And we'll just talk about your victories as well as things that you're struggling with. Because really, it's the story. It's the story of where you have been and where you are and where you want to go is where we want to focus. And we want to understand what's in your past and how we can help you. Everything we learn is an opportunity. Every experience, whether it's difficult or wonderful, is an opportunity to learn. And so we need to take what you've learned and apply it to the future so it's more beneficial to you and to your staff.
Yeah, that's a lot of wisdom right there. Alicia, I want to thank you so much for coming on the program. I'm going to put out your website one more time. It's increda-dental.com. Alicia Flynn, thank you so much for being here.
Patrick, thank you for having me. It was an honor. Have an amazing day.
Thank you for joining us on today's episode. Did you know you can weigh in on today's topic on Facebook? Search The Dental Brief on Facebook or visit our website, dentalbrief.com, and just follow the link. We look forward to having you join us again on another episode of The Dental Brief.